Bismillahirrahmanirrahim. As you know, we were discussing disease of thyroid gland. So last time we discussed hyperthyroidism. Today we will discuss hypothyroidism. So what is hypothyroidism? This is decrease the function of thyroid gland. So what is the function of the thyroid gland? The function of thyroid gland is the release of T4 and T3 thyroxine and triiodothyronine. So when T3 and T4 decrease T4 and T3, so we call this condition hypothyroidism. And when the T3 and T4 decreases, so the feedback will increase the thyroid stimulating hormone. So when we were checking the patient at the hypothyroidism, so we will see that the T3 T4 is decreases as well as the TSH is increases, and the TSH will be increases in order to increase the T3 and T4. Then there are some causes. So we will divide this into primary, I will write this, and secondary like this. There are some causes, primary hypothyroidism and secondary hypothyroidism. The primary hypothyroidism, there will be gland disease. It means that there will be defect in the gland. So gland when the TSH will increase and T3 T4 will decrease in the blood, and this will be mostly of gland disease. Primary means that the effect is in the gland and the at the primary location, and the T3 T4 secretion from the thyroid gland. So thyroid gland defect is the primary cause. Then what are the causes of the gland disease? So there are some causes of the gland defect. It can be Hashimoto's thyroiditis. Hashimoto's thyroiditis. Mostly it is in India nowadays. India. And endemic goiter. Endemic goiter means iodine deficiency, mostly in Russia, or you can say Russia and America. So these are the causes, as well as there are some food goitrogen causes by the eating of the cabbage family vegetables. When you are eating, so it can also cause the gland disease and decrease of the T3 and T4, as well as there are some drugs. We can drugs like amiodarone used in anti-arrhythmic condition. Then secondary causes. What are the secondary causes? That there will be T3 T4 decrease and TSH increase, hypothyroidism. So that is pituitary. In this condition also the TSH will be decreases. So pituitary destruction. So how will we differentiate that the patient have primary hypothyroidism or secondary hypothyroidism? So as we discussed that in the primary hypothyroidism, there will be TSH increase, but here TSH will be low. It means that the TSH from the anterior pituitary will not secrete. So when there is no TSH, so there will be no stimulation of the thyroid gland, and when there is no stimulation of thyroid gland, so there will be reduction of T3 and T4. In some condition, we have excess TSH, increase TSH, and decrease T3 T4. That is also a condition, but this TSH will be in inactive form, means that there will be a lot of TSH in the blood, but it will not bind to the receptors, and it cannot stimulate the thyroid gland to secrete the T3 and T4. So what are the causes of the pituitary destruction? So Sheehan syndrome, Sheehan syndrome. Sheehan syndrome is when there is less blood supply to the thyroid gland, so there is defect in thyroid gland. No, thyroid, the pituitary gland. So the pituitary gland can't release these hormones. So as well, so that's why pituitary destruction, or we can say apoplexy or impaction of the pituitary gland. Then there is another condition, sigmoids diseases. Sigmoid diseases like trauma, hypertension, trauma, hypertension, or tumor of the thyroid gland decreases the function of the tumor of the pituitary gland decreases the function of the thyroid gland. So these were when there is primary disease, so defect in the gland. When there is secondary disease, so defect in the pituitary gland. And the differentiation in the primary destruction, the TSH will be increased, T4, T3 will be decreased, and here all the hormones will be decreased. It means that neither the T3, T4 is secreting, neither TSH is secreting. So it means that there is problem in the gland. Then next is the clinical features. So there are certain clinical features. If these clinical features will be, so it indicate that there is hypothyroidism. First, there will be BMR decrease, basal metabolic rate. So BMR decreases, calorogenesis will be decreased. So calorogenesis will be decreased. So in this condition, there will be weight gain, and cold intolerance. And next is the myxedema. Mostly we are discussing this in the elder patient. So when there is myxedema, so there will be alopecia, puppy pace, hoarseness of voice. Then there will be hypertension. Hypertension will be like, for example, 120/100. So that will cause headache. Increase in the diastolic hypertension. In the female, there will be menorrhagia. One specific condition which will differentiate in the most effective side, it is hang of ankle relaxation. Hang up ankle relaxation means that there will be decrease, or it will take time to relax his ankle. And when there will be hang up ankle reflexes, so that is a condition in chorea. We discussed this in chorea. So there will be hang up relaxation, not hang up reflexes. One condition there is there will be galacturia. Sign of galacturia. Why there will be galacturia? As we know that from the pituitary gland, the posterior pituitary, the thyroid regulating hormone, regulate thyroid stimulating hormone as well as prolactin. So when it increases, so it will increase both the thyroid stimulating hormone as well as the prolactin. So in the primary cases of the primary hypothyroidism, there will be the sign of galacturia in the patient, as well as there will be jaundice of the skin, jaundice or yellow color of skin. The patient will tell the doctor that I have like hepatitis or jaundice, but there will be no jaundice. So in this condition, the beta carotene increases in the skin in the body, because there will be no feedback to decrease the beta carotene. In hypothyroidism, by the decrease of the thyroid hormones, so the beta carotene will increases, but there will be only the yellowish of the skin, not the eye. So that will be the difference, that that is the due to the decrease of the beta carotene in the body. We call this sign is coarse skin. Coarse skin, that is a sign, not a symptom. So these are all about the clinical feature. We will discuss the diagnosis. In the diagnosis, first of all, we will look thyroid stimulating hormone. So if we have increased thyroid stimulating hormone in free T4 and T3 decrease, so that is primary primary hypothyroidism. And when we have TSH decrease, T3 T4 decrease, so that is secondary. So in the primary, when the TSH increases and free T3 T4 decreases, so further we will check anti-microsomal antibodies. Anti-microsomal antibodies are anti-thyroglobulin antibodies. These are Hashimoto thyroiditis. Hashimoto thyroiditis. In order to confirm Hashimoto thyroiditis, we will check these two. And if this condition occur, so then we will check. Then we will do MRI of head. Okay. So that will our diagnosis will based on these. Further in the management is simple. We will give levothyroxine in order to increase the primary hypothyroidism, as well as we will prevent eating of food like cabbage, etc. As well as iodide salt. So all these are the management of the hypothyroidism. So these were us. If you have any question, you can ask me in the comment. Thank you.